If you're struggling with depression, anxiety, or sleep issues, your doctor may prescribe Amitriptyline Hcl to help improve your mood, relieve tension, and help you sleep better. This medication belongs to a class of medications called tricyclic antidepressants, and it works by affecting the balance of certain natural chemicals in the brain. It's important to take this medication as directed by your doctor, and it can take a few weeks to feel the full benefits. Typically, the daily dosage ranges from 25 to 150 milligrams, and it's best to take it at bedtime to help with sleep. Be sure to talk to your doctor about the best timing for you. Before we start, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth as directed by your doctor, usually 1 to 4 times daily. If you take it only once a day, take it at bedtime to help reduce daytime sleepiness. The dosage is based on your medical condition and response to treatment. Your doctor may direct you to start this medication at a low dose and gradually increase your dose to reduce your risk of side effects. Take this medication regularly at the same time each day to get the most benefit from it. Do not increase your dose or use this drug more often or for longer than prescribed. Keep taking this medication even if you feel well, and do not stop taking it without consulting your doctor. This medication may not work right away, but you may see some benefit within a week. It may take up to 4 weeks before you feel the full effect. Tell your doctor if your condition lasts or gets worse. Common side effects of Amitriptyline Hcl include drowsiness, dizziness, dry mouth, blurred vision, constipation, weight gain, or trouble urinating. To reduce the risk of dizziness and lightheadedness, get up slowly when rising from a sitting or lying position. For relief from dry mouth, you can suck on sugarless, hard candy or ice chips, chew sugarless gum, drink water, or use a saliva substitute. To prevent constipation, make sure to eat dietary fiber, drink enough water, and exercise. If necessary, you may also need to take a laxative, so it's best to consult your pharmacist to find the right type for you. While taking Amitriptyline Hcl, it's important to remember that the benefits outweigh the risks of potential side effects. However, be sure to contact your doctor right away if you experience serious side effects such as heartburn, easy bleeding/bruising, shaking, muscle spasms, severe stomach/abdominal pain, decreased sexual ability/desire, or enlarged/painful breasts. Also, seek medical help immediately if you have very serious side effects, including black stools, vomit that looks like coffee grounds, severe dizziness, fainting, seizures, eye pain/swelling/redness, widened pupils, or vision changes. Additionally, this medication may rarely cause a very serious condition called neuroleptic malignant syndrome, NMS, so it's important to get medical help right away if you experience symptoms such as fever, muscle stiffness, severe confusion, sweating, or fast/irregular heartbeat. While a serious allergic reaction to Amitriptyline Hcl is rare, seek medical help immediately if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. Please note that this is not a complete list of possible side effects, so it's essential to contact your doctor or pharmacist if you notice any other effects not listed here. And as always, if you experience any side effects, be sure to contact your healthcare provider for medical advice or to report any side effects. Amitriptyline Hcl is an antidepressant medication that is used to treat depression and other mental or mood disorders. It can also help prevent suicidal thoughts and provide other important benefits. However, it's important to note that some people, especially those younger than 25, may experience worsening depression or other mental symptoms when taking antidepressants. It's crucial to discuss the risks and benefits of this medication with your doctor, especially if you're under 25. If you notice any worsening depression, unusual behavior changes, or new anxiety or panic attacks, it's important to let your doctor know right away. It's also important to be watchful for these symptoms when starting a new antidepressant or when the dose is changed. The daily dosage and optimal timing for taking Amitriptyline Hcl should be determined by a healthcare professional based on your individual needs and condition. Before taking amitriptyline, make sure to inform your doctor or pharmacist about any allergies you may have, as well as your medical history. This includes conditions such as bleeding problems, breathing problems, liver problems, recent heart attack, problems urinating, overactive thyroid, history of glaucoma, mental/mood conditions, family history of suicide, seizures, and any conditions that may increase your risk of seizures. Amitriptyline may cause a condition that affects the heart rhythm, so it's important to tell your doctor about any heart problems you may have or if you are taking other drugs that may cause QT prolongation. Low levels of potassium or magnesium in the blood may also increase your risk of QT prolongation, so be sure to talk to your doctor about using amitriptyline safely. This medication may make you dizzy, drowsy, or blur your vision, so it's essential to avoid driving, using machinery, or doing anything that requires alertness or clear vision until you can do it safely. It's also important to limit your time in the sun, use sunscreen, and wear protective clothing when outdoors, as this medication may make you more sensitive to the sun. If you have diabetes, be sure to monitor your blood sugar levels regularly, as this drug may make it harder to control your blood sugar levels. Older adults may be more sensitive to the side effects of this drug, so it's essential to be cautious of symptoms such as bleeding, dry mouth, dizziness, drowsiness, confusion, constipation, difficulty urinating, and QT prolongation. During pregnancy, this medication should only be used when clearly needed, and it's important to discuss the risks and benefits with your doctor. Additionally, if you are planning on becoming pregnant or are breastfeeding, be sure to consult your doctor before using this medication. When taking Amitriptyline HCl, it's important to be aware of potential drug interactions, as they could alter how the medication works or increase your risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Certain products that could interact with Amitriptyline HCl include disulfiram, thyroid supplements, other drugs that can cause bleeding/bruising, certain drugs for high blood pressure, and MAO inhibitors. It's crucial to avoid taking MAO inhibitors during treatment with this medication, and to ask your doctor when to start or stop taking it. Additionally, other medications such as cimetidine, drugs to treat irregular heart rate, and antidepressants may affect the removal of amitriptyline from your body, thereby affecting how it works. It's also important to report all medications you are currently using to your doctor or pharmacist, as they may affect the heart rhythm. If you are taking other products that cause drowsiness, such as alcohol, antihistamines, or opioid pain relievers, it's important to inform your doctor or pharmacist. Check the labels on all your medicines, as they may contain ingredients that cause drowsiness. Aspirin can increase the risk of bleeding when used with Amitriptyline HCl, so it's important to consult your doctor or pharmacist if you are taking low-dose aspirin for heart attack or stroke prevention. Lastly, it's crucial to avoid using medications containing nortriptyline while using Amitriptyline HCl. If you or someone else has taken too much Amitriptyline HCl and are experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help by calling 911 or contacting a poison control center. In the US, you can call 1-800-222-1222 for your local poison control center, and in Canada, you can call a provincial poison control center. Symptoms of an overdose may include extreme drowsiness, hallucinations, fast or irregular heartbeat, fainting, slow or shallow breathing, and seizures. It's important not to share your amitriptyline with others, as it is prescribed specifically for you. Your doctor may also want to monitor your heart function, liver function, and the levels of amitriptyline in your blood through medical tests. Be sure to keep all of your medical and lab appointments, and consult your doctor if you have any questions or concerns about these tests. If you forget to take a dose of Amitriptyline HCl, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take your next dose at the regular time. Don't take a double dose to make up for the missed one. It's important to store Amitriptyline HCl at room temperature, away from light and moisture. Avoid storing it in the bathroom and keep it out of reach of children and pets. When it comes to getting rid of any unused or expired medication, it's best to consult your pharmacist or local waste disposal company for proper disposal instructions. Remember not to flush it down the toilet or pour it into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.